I'm really honored to have one of our guests of honor, Dr. Sanjiv Kumar here, and I request him to be on the stage, and I request Professor Gupta from Department of Management Studies, Professor Stan, and Mr. Kaustav Patil and Mr. Anurag Asthana to facilitate guest of honor, please.
Thank you.
So, I'd like to say something for our Dr. Sanjiv. Dr. Sanjiv is Executive Director of National Health Resource Center and WHO Collaborating Center, India. He's a 38 years of experience in public health in 29 countries, working in urban slums, war zones, fish ponds, deserts, academia. Dr. Kumar's wide range expertise includes strategic program reviews, planning, implementation, monitoring, evaluation of programs, capacity building of semi-literate village volunteers, strategic planning management of health programs for UNICEF. Dr. Kumar has developed facilitated courses for government officials and NGOs and supervised research projects for national and international organizations. He's also published 100 papers in scientific and popular magazines. Dr. Kumar heads the National Health System Resource Center, provide the technical support to the Ministry of Health and Family Welfare, state governments of India. Over to you, Dr. Sanjiv, please.
Thank you. Thanks for asking me to come over, and this occasion is important for me for two reasons. One is I am entering this campus after 42 years, and most of the people in the audience were probably not even born. And my contemporary batch of IIT is 71 batch. When I joined AIMS, and some of my friends joined IIT, we used to come here very often, and last visit was for Rendezvous. I really had good time. Those of you who are not familiar, Rendezvous is an event which is organized by IITs. All the IITs get together and you have a lot of fun, songs, cultural activities. So that was my last visit, and when I was entering this campus I was feeling nostalgic. Second is, at my age I am now a restless person. Why? Because health, though there is a substantial improvement, Stan mentioned about life expectancy has increased to 68 years. Can you guess what it was when we got independence, 1947? 32 years. So it's more than double. So something good has happened. At least an Indian is living on lives for an average of more than double of what it was when we got independent. Second indicator, if I can talk about, is infant mortality. Babies who are born and those who die before they become 1 year old. From 1990, when it was 80, it has come down to 40. Substantial improvement. Mortality rate of babies has reduced to half. But when I look at other sectors, and those of you who are around my age, we used to apply for telephone. And we used to wait for 5-6 years if we were lucky. And those of us who were luckier being doctors, they had a special quota for doctors. And then if you get a recommendation from an MP, each MP was given 10 connections. He could recommend 10 people in his constituency, then you will get, that was called double special category. And that is where we were growing, and phone in the neighborhood was a big thing. You know, everybody will like to be friendly with you so that they can come and use your telephone, and they can give your landline number to their relatives, friends abroad or outside the city or within the city. You can be contacted and you can call them. So that was what it used to be, not very long back, till early 90s. And then 95, when I moved back to Delhi from my first assignment in Jaipur for UNICEF, both the daughters were going to school, and my wife and both me were working. So we need to keep a tag on when they come home, are they comfortable, and especially mothers. All mothers are like that, and we are fortunate. God made mother. My wife will like to know, are the kids back home? Have they had their lunch? So she bought a mobile phone. And that mobile phone was like, you have these signal messages, big instrument with an antenna, and walkie-talkie. Yes, I always take help from technology people when I forget something. So that was the phone, and she used to hide it in the purse because she didn't want anybody to know you have a mobile phone. Even in UNICEF office, nobody had mobile phone. This is 1975, just 20 years back. And today, every one of us is carrying mobile phone in the pocket. So revolution has taken place but when I look at health, you hardly see any difference it has made. The technology, maybe my fraternity, the medical doctors are resistant to change. I don't know what is the reason, but I don't see in 20-30 years that change has taken place in health. So the second reason I am excited about is I am with a group of people who can bring that revolution in healthcare like we have seen in telephone and mobile telephony. And there are many other areas I can talk about. Your television. We used to have a big antenna on the roof of the house, and the reception will go bad. Somebody will climb on roof tap, adjust, and looking at the screen, I will tell them, no, do it further, and now the picture is clear. Stop. That is what we grew up looking at, and now you have a small box next to your TV. You have hundreds of channels. Hardly ever you have connectivity problem, and nobody has to climb the rooftop to adjust the antenna. And that is what we need to look at now. How can we bring that revolution to healthcare? So before I go further, let me tell you about what is health. Health as is defined, and all of us in health or related areas, those of you working in health technology also look at what is the definition of health, and that definition is 70-year-old definition. We are very fond. Talk to any undergraduate when health is state of complete physical, mental and social well-being, not merely absence of disease or infirmity. And when you go to Ministry of Health, you have a department of non-communicable diseases, you have department of communicable diseases, and I joke with my friends in the ministry, you are not Ministry of, you are Ministry of Disease. Because you look at disease prevention, you look at disease management, and everybody is very, so when you talk to IT people, health IT, but you are not doing health IT, you are doing disease IT. Hospital access, electronic medical record, how the appointment for the patient can be sought. So one concept I want to talk about is health is much more than disease. And when you look at the population, each one of us in the room and outside the room can fall only in four categories of health. One is people who are absolutely healthy, and the younger generation is healthier than the older generation. So this is those who have neither any risk factor nor any disease. IT and all of us working in health sector need to make sure that we keep these people healthy. They never fall sick. That is one thing we have to look at if you want to talk about health and technology for health. Look at this group. We don't look at this group. We look at investigations and electronic transfer of records, etc., etc. But look at this. And there are many devices available, but nobody talks of scaling them up. I have in my mobile phone, I have a target of walking 10,000 steps every day. I barely meet that target maybe once in a week or so, but I can monitor my physical activity. And similarly, there are many things which will keep you healthy, you can monitor. But nobody is looking at how is everyone, there are about 90 crore mobile phones in the country. How each one of those 90 crore mobile phones, and most of them are smartphones, I am told, how each one of them have those technology devices or the software which are available free of cost, but very few people are using it. So one is keep these people who are healthy, always healthy. Second group is people who have risk factor. God forbid, if your both parents are hypertensive or diabetic, you are likely to develop these diseases sometime in life. And now they have markers. If you have some markers, you are more likely to get cancers. So these are the people at high risk, and these people need to be more careful about keeping the healthy lifestyle. The third category is the people who have the disease. For example, we call India as diabetic capital of the world. But out of those who are diabetic, most of them are not even aware that they are diabetic. Their blood sugar has never been tested. So these are the group where we need to reach out to them so that they can detect the disease early, and then they can take care of it so that the complications are less and they can live as healthy lifestyle as possible. And the fourth category is those who are known to be hypertensive. They need to be looked after well, and it's not that only illiterate people living in remote villages or remote areas, they don't take care of it. I know one dean of a dental school who one day walked in and says, I've stopped taking antihypertensive drugs. You know, once an hypertensive is always an hypertensive. That's what we teach in our medical schools. And here is a dean of a faculty of dental sciences who says, I've stopped. What do? I do yoga and meditation, so I've stopped taking antihypertensive. So these are the people who need to be motivated to continue taking treatment, whatever is the treatment given to them on a regular basis. So you look at this spectrum of the whole population if you want to improve health of the people. And today we are living in an environment where we talk of health for all, we talk of universal health care, we talk of right to health. So the environment is that everybody who is healthy needs to remain healthy, and those who are not healthy, they need to get access to health care, wherever health care can be provided to them. And yesterday Dr. Supten was there in a health IT conference 2 days, and I was reflecting with them. But when you think about Indian culture, how do we look at health? All of us know Sarve Santu Niramaya. Right from childhood we have it. Everybody should be free of disease. Then you have those of you who have read bit of Sanskrit, Atharvaved, there is a shlok. 5,000 years the Westerners say the Ved has been around with us. It talks of Tachakshru Deva Hitam Purasta Chupram Ucharat Pashyem Sharda Shatam Jivem Sharda Shatam Shrunyam Sharda Shatam. Not only that, I should remain healthy, my eyesight should remain healthy for 100 years. I should hear properly for 100 years. So it looks at quality of life as you grow. So the target was 100 years of healthy life. So this is the environment in which we are living today. Everybody is talking of health and remaining healthy. So coming now to the area where what specifically innovation can do. Those who are healthy, for example, a pregnant mother. I don't consider pregnancy as a disease, though many of my doctor colleagues consider. It is a physiological condition which is necessary for procreation and continuation of human race like any other animal. When a mother is pregnant, in the neighborhood of Dr. Supten's office, there is a center called Mother Child Tracking System, and it tracks all the pregnant mothers in the country. And they get messages. You are 3 months pregnant, you need to do 1, 2, 3 things. You are 6 months pregnant, you need to do one thing. You went for last antenatal checkup, you need to go again. 27 million pregnant mothers we have every year. Each one of them needs to be tracked and given appropriate messages. When they deliver, the baby needs to be tracked, and this system is in place now. We need to scale it up so that every one of the pregnant mothers and the children is contacted and they get appropriate messages. There may be problems, but the system exists. So this is to keep them healthy. Second aspect is those who are sick. What do we need to do for them? God forbid. I'm sure all of us have had diarrhea or cough and cold or fever sometime in our life. What do you need? And every one of the diarrhea, cough and cold, neither you nor we expect anyone else to go to a doctor. Most of the time you manage at home, but you need to know when to go to a doctor. When dehydration takes place, when complication takes place. This technology can help them in their pocket. They can have information. When I have diarrhea, when do I go and consult doctor? When I have cough and cold, when do I go and consult doctor? When I have fever, when do I go and contact a doctor? And then when you move to the next step, if I want to contact a doctor, I should be able to contact a doctor either in a health facility or a private hospital or a private clinic. If not, can technology make the doctor available online? Can I contact my doctor on my mobile phone? So this is where technology will come in. And when I joined medical college in 1971, the then director Ramalinga Swami told us, he used to literally treat us like his own children. Children, we have shortage of doctors. I come back after 42 years to India, I still hear the same. 2015, I still hear the same. We will be living in full paradise if we say train more doctors and they will automatically go to rural area. They have not gone in last 60, 67 years of independence. It is not possible they will go now. So can we have a technology where a person sitting in a remote village have access to consultation of a doctor? This is happening. Tripura, I went to Tripura in one of the primary healthcare center. There was an optometrist sitting and examining a child. So I went around the center, came back to her. After 15 minutes, she gave a prescription to the child. I said, how come you have given prescription to, you are not an ophthalmologist? So no, there is an ophthalmologist sitting in Agartala Medical College. Whatever I was feeding, he was looking at it and he has prescribed. But why this was started in 2007? Why in 2015 this is not available to every Indian? Why have we not scaled up? So there are a lot of innovations I was discussing with Professor Gupta which are available but they are not being scaled up. Who is accountable for not scaling it up? Somebody has to be held accountable. So one is those innovations with people like you have put in your blood and sweat to come up with why it is not being scaled up. So that is one aspect we need to look at. So one is consultation, second is diagnostics. So doctor who has seen you maybe in remote area, he advises X-ray or some investigation. How can you sitting in a remote village get this investigation? We need to look at that. Some of these like teleradiology etc. are available. We need to move further on that. And the last aspect of care is treatment. What do you need for treatment? Medication. NHSRC is piloting a project in 100 villages. We are putting up like you have this dispensing machine at the airport, you want some snacks, you put in money, press a button and it falls out. Similarly, they have identified 30 medicines. So if this is anytime medicine, ATM we are calling it, anytime medicine, a nurse examines you, sends the information to a doctor and the doctor says give medicine 1, 3 and 5, 1 twice a day, 3 times a day and so on. And that medicine can then be provided. So there are these things, and once we take on, we are looking at when do we reach the last village. So what NHSRC is doing, those of you who are not familiar, National Health Systems Resource Center is a government institution working as a society to provide technical support to the ministry, and I am very happy. Lot of excitement in this place. We have 8 divisions and one of the divisions is healthcare technology. Youngsters doing lot of hard work, putting things in place, and this ATM was the concept which was developed by healthcare technology division in our office. In the month of July, the minister launched what is called National Health Innovation Portal. This portal have 2 sections. One is devices, one is program innovation. So if you have a device you think is exciting, you have tried it out in a reasonable area, you can upload it. And similarly, if there is a program innovation, you can upload. You have to enter some minimum information and then my team will download it, take it to, there are separate committees for these 2 areas. Take it to that committee will evaluate it. And if they find it is effective, cost effective, you can't afford very expensive, neither in India nor in US. No country has unlimited resources for health, so it has to be cost effective as well. It addresses burden of disease, the priority conditions which government is more concerned about, and then it is replicable. If it meets these 4 criteria, the Ministry of Health has committed, any state who wants to scale it up, the funds will be provided under what they call is program implementation plan, under which the funds are released to the government. So to end, We are at an exciting time. There are a lot of things happening. It has been late. Health came on use of technology much later, but we need to do our job. Otherwise, there are many people like me and you who are restless. Why are we not doing more in health as we are doing in other sectors to improve health indicators? We have made good progress, as I said in the beginning, but we are still lagging behind countries like Bangladesh, countries like Sri Lanka, Maldives, Nepal. Their health indicators are better than us, and we are what? In the introduction, Stan said, we are the pharmaceutical, they call it pharmacy of the world. 60% of the vaccine anywhere in the world given to any child comes from India. Medical tourism, people want to come to India because you have top class interventions provided by top class doctors. But why the indicators are worse than Bangladesh? Why the indicators are worse than Sri Lanka? We need to do something. Things cannot continue as they are, and each one of you can contribute to helping the government in improving health indicators. Thank you so much.
Thank you so much, Dr.